Yeah, so as I said, this is the module that we'll be starting today, advanced counseling skills and techniques. So today we are going to get the introduction to counseling, to understand what counseling is, how counseling generally works, but not just limiting ourselves to counseling, but to also understand what counseling psychology is all about. There are a lot of different definitions when it comes to all of this. Some people say they do counseling, some people say they do psychotherapy, some people say they do psychological counseling, and at the same time we have clinical psychologists as well. Then we have psychiatrists. So there are a lot of different people in this particular domain. So what we are trying to do is we try to understand each one of these so that we can form a better we can come up with better approaches when we meet different individuals with multiple problems. Okay, so now today we are going to discuss about the basics here, and I have shared the presentation on the WhatsApp group as well, and throughout this presentation you will notice multiple hyperlinks. You can click on those hyperlinks. Each hyperlink will take you to an article or a video, so that those would be your additional readings. Okay, now with that, let's just get a small start to what we want to discuss here. Now, since the at least if you consider the last 3-4 thousand years, people were interested in understanding how humans behave. Psychology as a field tries to understand the behavior and the cognitive process. So if there's a person with a specific disorder, it's very important that you understand how they think, which is the cognitive process, and then how people behave. And usually you can see externally how a person would behave when they go through some kind of a problem. Now, even during the time of Hippocrates, 400 60 BC, like before Christ even times, even at that time they were interested in understanding how people behave. Now those days they thought there are some imbalance in some bodily fluids, and as a result people tend to behave like this. And similarly, even Plato believed it is the ignorance. For example, it says here wrongdoings are due to ignorance and thus involuntary. What this means is if you do something wrong, it is because you don't know about it. So whatever things that are happening is not actually our conscious thoughts. And even very similar to that, I assume all of you are very familiar with the Dhammapada. If you go through Dhammapada, the very first set of verses tells something. What does it tell? It tells that everything happens inside the mind, and it stops inside the mind itself. So this is very important for us psychologists to have this understanding that a lot of things take place inside our mind. So when a patient comes and talk to you, we have to understand that they are dealing with something psychological. Now if let's say you are a physician, somebody comes and say, look, I think diabetes, so you can do a test. You can see whether the person has high blood glucose, whether that level is normal or not, and then for that you will prescribe medication. It might have something to do with how a person thinks, but then again that's not the sole reason. But if you consider someone who is going through like a rough marriage, someone who is having low mood, sometimes there is nothing physically wrong about that person. Everything is all right. So the only issue is having some psychological problem. So this psychological problem is very difficult to be understood sometimes. Now, this is one of the reasons why we need to learn how to do counseling. What are the skills that we have to have in counseling, and how we are going to approach when we meet individuals like this. The reason is there are oftentimes individuals who consider supernatural forces to have some effect on our behaviors. For example, in tribal societies, people think if someone has mental problem, sometimes the problem is due to supernatural forces. Some evil has possessed, some other thing is going on, and so on. So those are things like that. And you will notice in countries like Sri Lanka, not just Sri Lanka, but in other countries as well, even in the developed world, sometimes there are cults, religious cults. Now, if you see the image that I have put on the left side, this is Osho. People call him Bhagavan Rajneesh. He died in 1990 or so. He used to be very famous in India. He actually had an ashram and a city in America called Rajneeshpuram. He had many people following him, including white people in the United States. So he had a massive follower base because people were convinced that this person has certain things that usual people don't have, and he is someone who is similar to that of a god. Now, this kind of follower base comes when people are convinced that, okay, there is something supernatural going on, or there is something extraordinary happening. And I got this right side image from Rupavahini. I recently watched a show called, I think, Adrushyamana or something, where a lady named Sevandi Manio came and told that she can if the coconut is lying on her hand like this, she can make sure it rises up by 90 degrees on her palm without any specific support. And she demonstrated that a few times. Of course, we know that she is doing some trickery with her palm. But then again, she could convince at least some people about this because there were people who's going to, get treatments from her. Now, she is not providing counseling per se, but what she is doing has some similarities with counseling too. So, it's important that we have an understanding what's the right way of doing this and what are the wrong ways of doing this so that we have a better grip on how this thing actually works. Okay. Now, this is us trying to understand why humans behave the way they do. Now, having discussed all of this, let's try to discuss about psychotherapy. What do you think is psychotherapy? Now we have discussed about counseling a little bit. We know the word, but what is psychotherapy? See, now psychotherapy is what we call talking therapy. If you go to a psychiatrist, he will prescribe you medication. He can also do psychotherapy as well, but most of the times they prescribe medication because if there's a chemical imbalance inside your brain, that can be corrected through medication. That's the usual thing a psychiatrist would do, and since they are medical doctors, they are 100% capable of doing that as well. Okay? Yes, thank you. So therapies which are helping to deal with psychological problems. Exactly. Thank you very much. So that is very correct. See, uh, when people go through psychological problems, sometimes medication is not the only method of solving the issue. But I need to correct something as well. There are some individuals I have seen, those who are on social media and stuff. They say, "Don't go for medication. Just come for psychotherapy." No, it doesn't work like that. Sometimes medication is a must. The problem might look like it is small, but we don't know how it affects the person. So, whether to give medicine or not has to be diagnosed and decided by a professional, someone like a psychiatrist or a clinical psychologist. No one else can come to that diagnosis saying, look, I am not going to give medication you don't need. But even if medication is given, sometimes some people don't come up with positive results because psychologically still they are dealing with it. Sometimes we have very competing thoughts. If I think I am a loser, no medication will sometimes change my way of thinking about myself. I have to do something about it. So in that kind of situation, this kind of talking therapy helps, where you talk to someone about your issues and we try to come with a solution. Now, this was first started in Dr. Joseph Breuer's time. So, Dr. Joseph Breuer had a patient named Anna O. This is not her real name, but this is a pseudonym, Anna O. So, Anna O actually went through hysteria. So, she had hysteria, and Dr. Joseph was her physician, and he found that the symptoms related to hysteria gets alleviated the more he actually talked to Anna. And Sigmund Freud used to be a student of Dr. Joseph. So Sigmund used to work in Dr. Joseph's laboratory in University of Vienna those days. So It says here Breuer's interaction with Anna O display that he believed in. See, now when people have psychological problems, their bodies start to feel the things as well. Now, yesterday I was talking to a client, yesterday morning, and she told for the last 1 year she was having panic attacks. Certain times she can't breathe, certain times, she has body aches and whatnot. Now, none of those things are real things. Why? She doesn't have any difficulty breathing. It's just that because of the psychological issue, her body makes her feel like that she can't breathe. This is what we call psychosomatic symptoms. You are having an issue. This issue makes you feel that your body has something really, wrong going on. Most of the times people feel difficulty breathing, stomach aches, back aches, joint pains, quite a lot of things. These are all psychosomatic symptoms. But when you talk to someone, some of these psychosomatic symptoms can be eliminated, removed, or it can be, alleviated. So this was exactly what Joseph Breuer found during those days, which is one of the reasons why Sigmund Freud even thought, look, medicine is something, but there needs to be a different field. That's why he came up with psychoanalysis. So his psychoanalytic work was also because of uh, it was inspired from Dr. Joseph Breuer's work. Now, ever since this finding, there were many other approaches developed. So today we are going to discuss some of the approaches to understand how this counseling process and psychotherapy works. Okay. Now let's try to differentiate counseling and psychotherapy. A lot of people use these two terms interchangeably, but these two things do two very different things. Although there are some similarities, these two are slightly different as well. See, counseling is used with individuals mostly within ordinary instances. Let's say I have difficulty understanding what kind of a college I should apply later. Let's say I have difficulty understanding how to make some of my financial investments. Let's say I have some fight with my mother. For all those things, counseling is ideal. I can go to someone, I can talk through my problems, and most of the times they are very educational, informational. People can teach me, how to manage my family well. If you go to churches, churches have good counseling practices. Why? Because they train, young individuals. Okay, if you are getting married, these are some of the things that you should be doing. These are some of the roles that you have to play. These are some of your responsibilities. If you go to Dahampasala, in Dahampasala also, the teachers and the priests, they will tell kids, okay, these are the Amusami relationships, Amusami කියන මා සිංහලෙන් මේ Abu Sambandhata. So likewise, okay, if you are a husband, if you are a wife, these are some of the things that people should be doing. So we learn quite a lot of things. So those are counseling, and we can talk to a priest, we can talk to an elderly person, we can get counseling like that. You go to a bank, you get financial counseling. You go and meet a lawyer, you get once again legal counseling. You go and talk to a person in education institute, you get education counseling. So that is counseling. And counseling is something like that, but psychotherapy is very different. Although counseling is for ordinary issues, psychotherapy is usually when we do psychotherapy when a person experiences psychological disturbance. Now, for example, think I can have financial issues. For that, I can go for counseling, like learn how to invest my money and all of that. But what if I have done some blunders and as a result now I am psychologically feeling, distressed. For example, I think my life is useless. I think I need to kill myself. I think, I have let down my wife. And if I think like that, I am psychologically also disturbed. So for me, more than counseling, what I require is psychotherapy or psychological counseling. So, if someone is having psychological disturbance or neurosis means emotional problems. Okay, let me write it here. Neurosis usually would mean emotional problems. But this also, if you have very negative thoughts, if you are way too emotional, you are having a nervous breakdown. For that also psychotherapy is good. But only for neurosis, okay, not for psychosis. There's something called psychosis. Psychosis, plural is this. So psychosis. For psychosis, you can't give psychotherapy because it might not work well. Under the supervision of a psychiatrist, you might be able to do, but usually we don't do that much. Psychosis occurs when you have delusions, which means very unrealistic ideas, and when you have hallucinations. So these are instances where you actually get psychosis. Now, people with bipolar disorder, people with schizophrenia, they actually go through psychosis. Now, for that kind of situation, sometimes psychotherapy might not be the only mechanism to handle it, and then you have to go for medication as well. But if you consider this is neurosis and psychological disturbance, those are the places where you can go ahead and do psychotherapy. And when you do psychotherapy, you have to have a therapeutic approach, a therapy model. Now, CBT, cognitive behavioral therapy, is a very common model. We can treat someone using CBT. But CBT is not the only model, so there are a lot of models. You can select one of those, and through that approach, you can treat that person. And when you do this, you use certain treatment plans, and your sessions will continue for maybe a few weeks of time. And at the same time, psychotherapy can be performed by multiple individuals. Psychiatrists can give psychotherapy, psychologists can give psychotherapy, and psychotherapists can give psychotherapy. So, a psychiatrist is a medical doctor who has the capacity to provide therapy. Psychologist is once again not a medical doctor but can diagnose and give therapy as well. Psychotherapist is not a psychologist. Sometimes they are psychologists too, but most of the time, psychotherapist is someone who has extensive training in one of the models. For example, if you have only learned CBT and your training is 100% done in CBT, you may call yourself a psychotherapist. If you are someone who is trained in Sigmund Freud's psychoanalysis, you may call yourself a psychotherapist. So, something like that. So, this is the basic difference between counseling and psychotherapy. Now, Joseph Breuer found this while talking to Anna O. And very similar to that, there were individuals, especially after World War, when you go through wars, you always hear these bomb blast sounds and all of that. So there was something called the shell shock. When there's shell bombing, because of the shell bombing, when it gives this massive blast sounds, soldiers went through something called PTSD. So PTSD means post traumatic stress disorder. So people with post traumatic stress disorder, they feel fatigued, they feel tremors, and then they sometimes get really confused. They have nightmares. Sometimes they have difficulty seeing, difficulty hearing. And when this sounds, even when if lightning strikes outside, suddenly they think it's like a bomb blast or something, and they start to feel all these uh, bad symptoms. Now, even during those days, the doctors found psychotherapy is really beneficial. Like revisiting what they have experienced, understanding how they went through these things is very helpful. Now, Sri Lanka went through a war some years back, and even in Sri Lanka, research findings says many soldiers still have psychological issues, in the sense after a war, when you go there, you sometimes you go there with your friends, in the sense maybe the next soldier could be your friend, but while you fight, you lose people next to you in both sides, not just the army, but the terrorist side as well. People who fight lose their friends and loved ones and all of that. So those things start to stay inside your head, and then it will later give psychological issues for people. We sometimes call them psychological maladjustments. Now these kind of things are very common among the Sri Lankan population as well. People who have seen war, experienced war, and all of that, not just the soldiers. So even in Sri Lanka, this psychotherapy is very important. There are a lot of researchers who have done psychotherapy in the north and the east, and also among army populations, to see how we can help them overcome this kind of issues. So this was exactly how psychotherapy started. And by 1945, first they started the school for clinical psychologists, and later they started a separate section for counseling psychologists as well. Now, there is one thing you have to remember, that is, all psychological disorders are available in the DSM. DSM is a book. DSM stands for Diagnostic and Statistical Manual for Mental Health Disorders. Right now we are in the fifth edition. This book has every the symptoms related to every mental disorder. Any psychiatrist, any clinical psychologist usually has a copy of this book. So whenever a patient comes, they will be assessing the patient against the criteria given in this book. And counseling is not that much focusing on this kind of diagnosis. This is what clinical psychologists and psychiatrists do. A counseling psychologist would be, mainly focusing on alleviating the symptoms of the person and taking this talking therapy further to help individuals overcome the issues. So let's try to see what clinical psychology is all about and what counseling psychology is. Now we know there is something called counseling, there is psychotherapy. Now we know psychotherapy has become very popular in the late 1950s and so on because of war and everything. So in 1945, they started the School for Clinical Psychology. Now, clinical psychologists can do certain things. First one, psychopathology. Psychopathology means identifying the reasons for a particular disorder. Let's say if I am having depression, how would the psychologist or the psychiatrist would know that I actually have, depression? So that is something, that we would have to do. So psychopathology means identifying why exactly someone is having this kind of a issue or a disorder. So that is psychopathology, which is, part of what clinical psychologists would do. And they can also assess the cognitive, behavioral, emotional, and interpersonal functioning of people. So how people would think, that comes under cognitive. How people behave, that comes under behavioral, and our emotional reactions, and how we interact with everyone else, in the society and all of that. So those things are assessed. When those things are assessed based on their findings, they can come up with interventions. Are what these are what we call treatment plans, but we usually don't call them treatment plans, we always call them interventions. So for a set of symptoms, we can come up with an intervention, and then only the rest of the process will start. And usually we do quite a lot of research to identify what kind of interventions are the most, beneficial ones for people. That is exactly how we usually take out this process. And it is very important for clinical psychologists to maintain a good relationship with their clients. Communication is extremely important, and at the same time, everything that they do be has to be within a ethical framework. At the same time, they have to have good understanding about what is right and what is wrong. So the legal aspects of things are also very important, and you have to be a professional when you do this, and you have to consider everything that your client says within a biosociocultural framework. There are biological reasons why people get into mental problems. There are social reasons, and there are culture specific reasons. If you are a psychologist, when you try to understand a particular person's problem, when you diagnose, when you go through their cognitive, behavioral, emotional, and interpersonal, you know, aspects of their life, you have to also understand that there are biological reasons, there are social reasons, cultural reasons behind the particular person's disorder. So this is pretty much what a clinical psychologist would do. But when clinical psychologists do work with people, they have a lot of assessment tools. like depression inventories, anxiety inventories, schizophrenia, structured interviews and so on. So they use a lot of tools. Now, this is one of the major differences between the counseling psychologist and the clinical psychologist, because clinical psychologists rely too much on, sometimes too much on, these kind of tools. In counseling psychology, the counseling psychologist can do almost everything, that a clinical psychologist can do as well. It's just that the counseling psychologists have a very less emphasis on testing. So if you are a counseling psychologist, probably you might not try to diagnose a person all the time. A clinical psychologist will always diagnose, because that is how basically that process would work. But for a counseling psychologist, it is not always necessary to diagnose a person. I can probably help you overcome your issues and your symptoms without necessarily diagnosing you. I can diagnose you if I feel that it is important, so that you can be referred to a psychiatrist to go for medication and stuff like that. And they also can do the diagnosis as well. So it is not always 100% necessary. And counseling psychology is a distinct field. Just like clinical psychologists have a different school for them, counseling psychologists have a separate school for them as well. In Americas, this began in 1940s, and this is heavily influenced by humanistic and existential movements. Now, let me tell you something. Clinical psychology is mainly focused on understanding disorders, right? But in counseling psychology, the focus is not always disorders. People can have psychological problems that are not disorders. For example, think like this. I can be a person who is depressed, and a psychiatrist can diagnose me to have major depressive disorder as well. Now, for that, I can receive medication, I can take psychotherapy also. But what if I don't have depression, but I still have a very low mood to a level that I don't do anything? But I am not suicidal. I don't have any intention of killing myself. I am very negative. I can't think of anything positively as well, but I'm not depressed. It's just that I have a low mood and I'm a very negative guy. If that's the case, maybe medication might not actually work for me, because I don't have a disorder per se. It's just I'm a very negative person. So this is one of the reasons why counseling psychology became popular later, because when you don't have a disorder but you still deal with something, there needs to be something else to take this thing forward. So humanistic and existential movements, these are certain philosophies that became popular in the 1800s and 1900s. So humanistic means, this comes from humanism. Humanism is, once again, I'll write here, humanism is a particular philosophy where they believe that people are naturally capable of finding positive things in their lives. And very similar to that, existential movements. So this comes from existentialism. Existentialism is, once again, a philosophy. Existentialism comes from something called phenomenology. Now, see here, this person on the right, this is Edmund Husserl. I have given a hyperlink here. When you click on this link, it will take you to a video where the video will explain what phenomenology is all about. Phenomenology is where we try to understand experiences of people. If you are a negative person, I can't possibly help you overcome your negativity without understanding why you have become negative. I want to know in which particular situations you try to see things as negative. I want to know how you see the world. I want to know how you view your friends. I want to know how you view your family and all these kind of things. So, in phenomenology, we try to understand the meaning you place on things. In phenomenology, we try to understand your experience. By understanding your experience and how you make sense of things around you, we can try to see and we can try to come up with the solution for the problems. Not like a clear cut solution, but I can equip with you equip you with the skills to overcome that problem. So phenomenology, existentialism, these are, excellent philosophies. So these philosophies are heavily being used in counseling psychology. So counseling psychology is not diagnostic criteria driven, but rather they are grounded in philosophy, where we try to understand problems of a person. Now I'll tell you a good example. These days, I provide counseling to an individual who has gone through a divorce with his ex wife. He has another relationship with another woman in Sri Lanka. This person is in Australia, and he has another relationship with a woman in Kurunagala as well. So, three relationships maintained at the same time. And he is finding it very difficult to settle to one person because he thinks, this person is capable of this. She is financially stable. But if I go with her, I will never be happy. But if I go with the person who is very happy, I will be financially unstable. If I go for the third person, she is very caring, but she is, slightly adamant too. Now, he finds three different characteristics that are highly appreciated in each one of these individuals, but he cannot settle for one person, and he always neglects making that decision. Now, he doesn't have a psychological problem per se, he doesn't have a disorder, but he's dealing with some issue. What the issue is that he finds it difficult to make that decision, and that decision keeps on putting him in a problem, a never ending problem, because the problem keeps on going. This problem has been occurring since, I think, last 10 or so years, because he never um, he thinks that he is not capable of making this decision, and since he doesn't make that decision, he tends to stay in the same cycle. Now, those are things that you can address through counseling psychology or through psychotherapy. And your understanding, therefore, on philosophy is very important. If you can understand how people behave, like what are the reasons, what exactly is the role of the society, what exactly is the role the family would play in our lives, and all of that. So, those are extremely important. This is why counseling is grounded in philosophy. So if you click on this particular link, it will show you more differences between a counseling psychologist and a clinical psychologist. So you can go through that later. But let's try to understand a little bit more about counseling and psychotherapy. So there are multiple approaches. The most commonly used approach is what we call CBT, cognitive behavioral therapy. Then we have here psychoanalysis. Psychoanalysis was found by Sigmund Freud. So we have Sigmund Freud here. I have given a hyperlink. You can click on this and watch a video about Sigmund Freud as well. And there's another one called person centered therapy. Person centered therapy was developed by Carl Rogers. Carl Rogers is also a humanistic psychologist. So earlier we discussed about humanism. So this is the key person in this particular field, humanistic, psychology, and he developed this person-centered therapy. And these are recent ones. Dialectical behavior therapy. Dialectical behavior therapy was mainly developed to help individuals with a disorder called borderline personality disorder. There's a disorder named borderline personality disorder. We call it BPD. So, to help individuals with borderline personality disorder, this dialectical behavior therapy was developed. And then we have another one called acceptance and commitment therapy. Now, let me show it to you further. If you consider cognitive behavioral therapy is actually an umbrella term. Okay. So, cognitive behavioral therapy doesn't necessarily mean just cognitive behavioral therapy, it's an umbrella term. So, we call cognitive behavioral therapies. But when we usually discuss with someone in our field, when we say CBT, we usually refer to CBT of Aaron T. Beck. See here, I have mentioned Aaron T. Beck. Aaron T. Beck, this is Aaron T. Beck. Aaron T. Beck was a psychiatrist. He developed a specific thing called cognitive behavioral therapy, which is what we mostly use right now, which is why we always consider CBT to be Aaron T. Beck's CBT. But in reality, CBT is an umbrella term, and there are multiple stages in different times. Different CBTs came into existence. So, cognitive behavioral therapy means it tries to always combine two things. When you do CBT, you have to always treat the person for how he or she thinks, and also you have to change their behavior as well. So, it is a combination of cognitive strategies and behavioral strategies. So in the earlier 1900s, which means 20th century, there was a person named Joseph Wolf. So this is Joseph Wolf. So he was a South African psychiatrist. He is the person who actually developed systematic desensitization. Let's say you are afraid of something, we can give you therapy where you are slowly exposed to the thing that you are afraid. Let's say I am afraid of snakes. So if a snake comes here, probably I would freak out. But if the snake can be, systematically exposed to me, for example, I first look at a picture, then I look at a video, then I see a serpent, close to the door, and then little by little, if it approaches me, after some time I'll be okay. This is something called, systematic desensitization. Now, these things appeared in traditional behavioral therapy. So in CBTs, the very first beginning was just behavioral therapy. In your introduction, you may have learned about something called behaviorism, B.F. Skinner, and John Watson and all of those fellows. So they started this normal behavioral therapy. So behaviors of people can be changed. That was the beginning. We call them the first wave of cognitive behavioral therapy. Okay. And the first wave later developed into the 1950s, 60s version. That is the second wave, where Aaron T. Beck came up with cognitive behavioral therapy, his style of cognitive behavioral therapy. Now, Aaron T. Beck was a medical doctor, a psychiatrist. He was trained in Sigmund Freud's psychoanalysis. But when he was working with people, he understood that Sigmund Freud's style it takes so much of time. It is not efficient. And Sigmund Freud believed unconscious forces determine how we, think and behave and all these things, and it doesn't make any sense. So as a result, Aaron T. Beck came up with this particular style of CBT. Why? Because Aaron T. Beck was convinced that there are certain things called automatic thoughts that goes inside our minds. Let's say, let's say that I believe that I am a massive loser. If I believe that I am a loser, when I go outside, probably I might think, today is not the day for me. I'm not going to do anything. Or maybe I'm not good at doing things like this. Oh, that person is not going to talk to me. These are just automatic thoughts that keep on, popping inside my mind. And why do these automatic thoughts come? Because, I believe myself to be a loser. Now, this was not addressed in psychoanalysis and other kinds of, therapies during that time. So, Aaron T. Beck identified this while he was trying to figure out a mechanism. And this was how the second wave of CBT came into existence. So, Aaron T. Beck's CBT, this is the one that we commonly refer to as CBT. But during the same time, there was another individual who was working on the same thing simultaneously, and that was Albert Ellis. Albert Ellis was a psychologist. He considers himself to be a psychotherapist, and he was not a medical doctor. He developed something called rational emotive behavior therapy. So both CBT and REBT, they believe psychological problems to be linear. So I don't have a ruler here, so I have a comb here. So psychological problems are linear. What this means is you have something, this problem gets you to another problem and to another problem and another problem. So you do have some actions. Actions lead to, certain beliefs, and then these beliefs lead you to some consequences and so on. So it is linear. But that was what people in the 1950s and 60s found. psychological problems have a linear fashion. Some person say you something and then you interpret it differently, and then you start to have some negative ideas about yourself, and likewise. So it's always linear. But this was changed very recent in late 1990s and early 2000s. We have the third wave of cognitive behavioral therapy. So where we try to focus more on mindfulness and acceptance strategies. See, when a person comes and tell us, look, I am not a good person, I have been trying to go with do quite a lot of things, but I was not successful. The moment I tell them, look, I think your thinking has some issue, it's like, blaming the person for who he is. And sometimes it's very difficult to tell something like that also. So what you have to do is you have to get the person to accept the things that are happening in his or her life. Let's say if I am a father and if I lose my son over an accident or something, I will never forgive myself. So when I go to a psychologist, and if the psychologist say, look, you have to change your style of thinking here, yeah, that makes sense, but it is very difficult. I can't change the style of my thinking. I can't tell that, I am no longer, I am forgiven and things are okay. No, I will never forgive myself. Then there needs to be some way of accepting what I am dealing with. So for that, I had to be very mindful about the things that are happening. So Aaron T. Beck and Albert Ellis, those days they thought psychological problems to be linear, but right now in 1990s and 2000s, even at present, we believe psychological problems are non-linear. What it means is all problems could affect you at the same time. There doesn't need to be a triggering point and an ending point. Problems could exist at the same time. How I think, how I feel, my coping, and all these things could occur at the very same time, making these problems really big to handle. So in this third wave, DBT is one of the therapeutic approaches. It stands for dialectical behavior therapy, developed by Dr. Marshall Linehan to treat individuals with borderline personality disorder. This is Dr. Linehan. I have given a hyperlink. You can click on this and join, watch the video. And ACT was developed by Dr. Stephen Hayes. So Dr. Hayes is an expert in understanding what kind of language patterns get people to have these negative ideas. Now, remember one thing, this is still cognitive behavioral therapy, but behavioral is extremely important in the third wave. In the first wave, also the prominence was given to behavior. In the second wave, the prominence is given to cognition, like how you think and all. But in the third wave, once again, the focus is on behavior. You can change behaviors of people through therapy. You can change how people react to certain things as well by amending behavior. So both DBT and ACT, especially ACT, it is focused on certain behaviors. For example, verbal behaviors. Verbal behaviors means how we speak. The more you talk, or the more you use negative language in your day-to-day conversations and all, the more the negative effect you are going to have in a lot of psychological problems that you have. So there are certain models that they have drawn for those things, for people to understand those things further. But this is just a start for us to get an understanding about how the first wave differs from the second wave and the third wave and so on. Okay, now these are just basic CBTs. So as I said, CBT is an umbrella term, and under that you have the first wave ones, the second waves, and the third wave ones. So in this particular module, we will be focusing mostly on the second wave, the cognitive behavioral therapy of Aaron T. Beck, which is the one that most of the times people commonly learn, and practitioners commonly learn and use. Okay, now let's try to understand further, like a few things about counseling psychology. So here we don't use the medical model. Clinical psychologists tend to use a medical model, something similar to that, and because they both the psychiatrists and psychologists, clinical psychologists, they use the DSM. But here we don't use a medical model per se. And also, we don't use diagnostic categories. And the main reason is in counseling psychology, especially in therapies like ACT, we believe problems to occur because of certain deficits people have in psychological process. I'll give you one example. Let's say I have trouble connecting with my wife or something. So I argue with her the entire time. She asks me a question, I always lash out at her. Why do I do like this? Because when she asks me a question, I never come up with answer. I try to avoid it. Now, avoiding problems could be something that I have been always doing, not just wife's problems, but every other problem as well. Why? Because when problems come, I don't know how to cope up. So, coping is an essential skill any person should possess. When I don't have good coping skills, whenever problems come, I tend to, become very neurotic, very anxious. I try to make a big scene and all of that. So that is me being my usual self. But I lack a very important psychological skill. A very important, process is affected because of the work that I do. And that is coping. So when you go and talk to a counseling psychologist, specifically if they are trying to do something like ACT, acceptance and commitment therapy, they will notice, okay, look, this person lacks the capacity to effectively use certain psychological process. So without diagnosing, without putting the person to a particular disorder, they will try to correct the psychological process. And by correcting this psychological process, we can improve the life of this person, not just for this issue that he has with his wife, but for the issues that he will encounter even in future as well. So this is something that you can do in counseling cycles. So there are no diagnostic categories, no medical model, and we don't use language of pathology as well. Like we usually don't tell, look, I think you have like a bipolar disorder or something. Persons might come to you with diagnosis. A psychiatrist or a clinical psychologist may have diagnosed them earlier, but doesn't necessarily mean you need to stick to that diagnosis and always remind the person of the diagnosis. We rather, focus on the particular process that are affected. And so because of that, we use a much more human sciences model. And at the same time, it's very important, at least in the contemporary times, psychotherapy focus more on developing skills of the clients. We try to develop skills of people. If you get the DBT, dialectical behavior therapy, the entire therapy has separate skill building books where the practitioner teaches how to develop certain skills in people. Usually, people with borderline personality disorder, they find it very difficult to maintain good interpersonal relationships. So, if it is difficult to maintain interpersonal relationships, then I need to give some skills for that person to do that. How to talk to someone, how to stay without fighting, how to understand another person, how to assert how I feel. I don't need to fight always with people to get my point across. So things like that. So coping skills, assertiveness means being able to speak and say your ideas, and then time management. So these are very good skills that we can help another person have. So these are extremely important. So we can teach these skills to people in this kind of counseling work. So we call them skill-based approaches. Right now, earlier, if you get the 1950s and 60s, the counseling approaches or psychotherapy approaches like CBT were still, trying to have some diagnosis for a person and trying to change each and every other symptom. But right now, ACT, DBT, we call them skill-based approaches where we try to develop skills in people. So that is one of the important things that we have here, because, for example, in ACT, the objective is to make the person psychologically flexible. If you go to a person who is practicing CBT, if you go and talk to a psychologist whose main form of therapy is CBT, probably they might tell, look, the way you see the problem is problematic, your interpretations are not right, your thinking is negative, let's try to come up with alternative thoughts here. Let's try to, change your interpretation here. Those are very good. But the thing is, sometimes problems are far too complicated, and during those times, what I need is not the alternative uh, way of thinking, but flexible thinking. Thinking flexibly requires more training and also more support and guidance. So, a psychotherapist or a psychologist who's using something like ACT can help a person to think flexibly. So, for example, if I have lost my son, every day when I get up, I will think about it, but I'm not doing anything to drastically, change myself. I am rather changing my reaction to it. So if you go to a CBT therapist, they will try to change your thoughts, change how you view and interpret and stuff like that. But if you go to a ACT therapist, they will try to change your reactions. Thought will come, it will stay, it will go, but you are going to control how you react to things. So it's very difficult, but once you learn or master that skill, it is something that will stay for a long time. So these are some of the subtle differences between these different therapies, but nevertheless, very important for anyone to use. So this is us just trying to understand some of the differences between different approaches, but we are not straight away going into understanding these major differences. This is just for us to have some uh, little ideas about what these therapies usually are. Okay, so now we have some understanding about counseling, psychotherapy, approaches to counseling and psychotherapy, and also what the contemporary psychological counseling is all about. So let's try to understand the key principles in this. What are the key principles in counseling? One thing that you have to understand if you ever become a counselor or a psychotherapist or a psychologist is that you are dealing with two things called subjectivity and intersubjectivity. You are talking to a person. So when you talk with this person, I have given the meaning of subjectivity and intersubjectivity. These two ideas come from, once again, phenomenology. So this is Edmund Husserl. Edmund Husserl was the pioneering person of phenomenology. I told that we try to understand experiences of people. So understanding experiences is a very subjective process. See here it says uh, perception or experience of reality from within one's own perspective. When you tell me that you have gone through a problem, I try to understand your problem through what I believe is to be correct or wrong. When I tell that I lost my son, if I come to therapy at your clinic, you will try to understand my problem based on how you see these kind of things, based on your values, based on your experiences, and so on. Maybe the problem that I have experienced will you will never be able to understand it to 100% if you have never gone through it. So it's a subjective thing, and oftentimes limitations in your perception, limitations in your experiences limits your capacity to understand my problem also. It's like, going to a war affected zone and trying to talk to a person to understand hardships they have gone through because of war. If you have never gone through war, you can listen to that person's stories, but you will never understand how much of difficulties the person actually felt, because I have limitations in understanding that, because I don't have any such experiences. I can think, I can rationalize, but it will never be the same. And at the same time, intersubjectivity occurs. See, interchange of thoughts and feelings, both conscious and unconscious, between two persons. Now, you and I, when both of us talk, both our subjective experiences get together, and both of us try to make sense of what is happening. So when we both try to make sense of something, then intersubjectivity comes into play. So counseling is something where you have to constantly deal with subjectivity and intersubjectivity. In the medical world, things are objective. You have a disorder has to be treated like this because that's the proven method. But in the realm of psychology, sometimes that kind of objective things might not always work. I'm not saying objective things are wrong. They are, of course, correct. That's why they are objective. But then again, you are dealing with people. People are subjective. So therefore, you have to deal with the subjective and intersubjective, subjectivity and intersubjectivity. And also, empathy is extremely important. You have to empathize with the person in front of you. And to have such empathy, understanding problems is very important. Now, if someone comes and tell me that, look, I have gone through a massive financial issue because of COVID and because of the forex crisis that Sri Lanka recently experienced. And if someone comes and say I lost my company, yes, I can rationally understand what exactly he's intending to convey here. But then again, for me to fully empathize, I have to critically, I should be able to reflect and understand what exactly he's saying here. What was his experience? What exactly was meant when he mentioned that he lost his company? Was it just losing the physical office? Was it just, losing employees? Was it, just not just those two, but, putting down that the respect, the esteem he once had when he used to have these companies? Was it those things as well? It could be a combination of a lot of things, and I probably might miss certain aspects. So if I need to empathize with him, I should be able to place myself in his shoes. The moment I place myself in his shoes, at that moment I can empathize. So then I am being very genuine here, because I try to understand his problem by placing myself in his shoes. So whatever he experienced, I can relate to. When I try to be like that, and for me to do that, I need to have good experience in doing therapy. So to be practice led, we need to make sure whatever the therapy that we use is research based. It has enough evidence to tell that, okay, this particular therapy style is actually working, and we have found it to be beneficial for people. Regardless of the therapy that you use, whatever that I mentioned right now, the subjectivity, intersubjectivity, and empathy, these are basic things that you need to have, regardless of the therapy that you do. You can do CBT, DBT for that matter, but these things are basics. These things are very important. These are what we call the basics or the fundamentals. Without these fundamentals, it's very difficult to do psychotherapy. And we have to recognize the social context. You can't understand a problem of a person without understanding the context that it appears. Um, if you go and talk to, let's say, someone who is working as a estate worker, their experiences and their socio-cultural elements surrounding them would be very different from someone who is born and raised in Matara, for that matter. So you have to understand the context. People come and always talk about their marriages and everything. And when I talk to individuals in Colombo, they would say, why do you consider about these things? These are simple issues. Yeah, simple issues for Colombo. But if you go outside of Colombo, where people are much more conservative, then religion, the social structures, and how people believe in certain customs in their societies, in their communities, those things play a key role. You can't just sacrifice them all of a sudden. So then the social context do play a key role here. And then discrimination. So when you talk to a person, you should empower the person as well. You empathize, so you understand their problem, but you help them develop certain skills, and those skills will empower them to take control. When they take control, now they are going to sort out their issues, because we can't advise people, we can't push people to do stuff. We can help people so that they will discover what they want to discover. So for this, we need to have a higher degree of self-awareness. Now, if you go to this particular slide and if you click on this link, hyperlink about Dr. Stephen Hayes. Stephen Hayes explained how he developed ACT because he was getting panic attacks all the time. It's a 20-minute video you should definitely watch, and it shows how much awareness he has about himself. Sigmund Freud identified these things because he was investigating himself. Once again, he had so much of self-awareness, so his particular desires, his particular emotions, that is what he used to understand more about everything else as well. So for a psychologist, or for a counselor for that matter, self-awareness is very important. I need to know what I feel when I go through an issue. If I am scared of something, I know I am scared of it. If I know I am jealous of something, I know I am jealous of it. I know about that 100% when it happens, because that is what self awareness is all about. You have to be aware of yourself. We can teach ourselves how to deal with those, but acknowledging them is one of the first steps that we need to have. So, as I mentioned, counseling and psychotherapy, we have their roots in the phenomenological tradition, or the phenomenology, the philosophy. And then here in phenomenology, as I mentioned, we try to understand subjective experiences of people, and it's extremely important that valid knowledge and understanding of what clients bring to a session. See, here you have to explore a little bit more. No client will come and tell their problem A to Z at a stretch. We need to, through conversation, explore things a little bit further and further. This is why understanding how both of us make sense of issues is very important. We can dig a little bit and get information. Now, can you tell me a bit about your family? Where do you work? What kind of people you associate? Now, they might have no relevance to the problem per se, but it will help you understand certain crucial things about the person. So, when I do this, I have to bracket out everything else. Now, as a person in my day to day life, I have certain beliefs about myself and about others as well. Now, one good example is I believe in this world there's only men and women. But now, there's a huge transgender thing going on, and oftentimes when I talk about this, people argue with me. Very recently, also, I was in another institute, and people were arguing with me, saying, you should be supportive. You know about this. Yeah, I know about all of that, but I was just saying how I see things personally. But the way I see things personally has nothing to do with what another person says when I'm in a therapy room. Sometimes a person who identifies themselves as a transgender person might come and talk to me. At that particular moment, my personal beliefs about what gender is, and it's there's only men and women, nothing else. Those things I keep aside. I don't need those things to come and do anything inside my therapy room. This is why I'm saying self awareness is very important. Just because someone disagrees with me is no reason for me to fight with that person. People disagree with us all the time. We can disagree and still communicate. We can disagree and still be friends. So, likewise, it's very important that we bracket our ideas. That's a very important aspect in our, uh, the usual therapy. So, for example, I was talking about gender, right? Now, the in United States right now, there is this huge thing going on in gender, where some people think, now originally there's men and women, and there's a sizable portion of people who have something called gender dysphoria. They have severe stress and distress related to their gender. So, for example, some people think they are originally born as women or men, but they think they belong to the other side. So these are transgender people. Now, I personally think there's men and women, and there are some people who have some issues in this thing. So there's a transgender community as well. I believe in that. But then again, right now, in the present situation, if you consider countries like United States and England for that matter, this problem has gone into a much severe level where pronouns have become very important. Like you had to call people who identify transgender as they, everyone else is like a he or a she, like these kind of things. Now, I am personally against those things. I don't believe I need to change my language because of someone else. But then again, when I go to my therapy room, I don't let those beliefs affect the quality of the therapy that I do. Whatever the beliefs that I have personally, I need to keep it aside. This is what we call bracketing. Bracketing in the sense we put all of them inside brackets and then we push them away. So sometimes people ask, how do you help individuals who are homosexuals? See, it's the same thing again. I don't need to be a homosexual person to treat someone who's identifying as a homosexual. So, what I believe to be the right way of romantic relationships and all of that is not relevant to the issue that I'm dealing with here. So, my personal beliefs have no room in this particular place. And if I am bothered by something like that, what it tells me is that I need to be more mindful about my understanding of issues. I have to revisit, because I'm not saying, I have understood everything about myself, then I would be enlightened. No, right? So I have certain limitations in understanding certain things. So if someone points that out, I always, sit down and I start to have some reflections about, how I think, how I do things, and is this the right way to do stuff? What if I have offended someone? So you have to think. So that comes with self awareness. If I'm uncomfortable with something, if I feel upset when I do something, it tells more about myself than it says about the other party. So then in that case, it's very important that I suspend my own assumptions, values and beliefs when I do therapy, because sometimes you will meet people who are 100% opposite of what you think. So we should still be able to uh, work out things with them in the same therapy room. Okay, so that's something that's very important, and these things will help you to build up the therapy relationship, because it's sometimes people come and tell all their problems to you 100%, but most of the times people retain most of the information. This was something even Aaron T. Beck noticed when he was developing CBT. People come and tell only an interpretation of what they have experienced. They usually tell you a little bit of what they have experienced, because sometimes they are confused with their experience, and other times they think, okay, look, this is not needed for my therapist. So you have only some limited information to deal with the issue here. So it's very important we know how to improve the relationship with the client so that we can get them to open up more. So working on the relationship you have with your client is extremely important in that sense. And compared to clinical psychology, so here also we try to get a scientist practitioner model, but more than the scientist practitioner model, here the emphasis is on the reflective practitioner. You have to reflect on your experiences. When I talk to a person, if I think that this person benefited, that's good. But if this person is not benefited, then it says something about myself. Now, very recently, I was doing therapy, and then this was, I think, not very recent, like about 1.5 years ago. One of my clients told, he hates CBT because it doesn't work. And then he told me he prefers existentialism. Then I said, okay, why? Help me understand. And he, when I did therapy, I understood this type of therapy sometimes is not preferred by some individuals. Very recently, I went to another individual. I met him in a hospital. He said he had multiple other therapists before me as well, and he said, don't say another single word about DBT. And he had a DBT skills book, a printed out book. He said his previous clinical psychologist gave this book to him, and he said, look, I understand what you are saying. I have this book. I try to change myself. You tell it now for the next 45 minutes, I am okay. But once you leave, within an hour, I am still my usual self. If I can change myself like that, I would have done it already. So when he told me that, I actually came home and I started to think, okay, if this is the thing, then what am I going to do? So when I ran into trouble like this, I actually call and ask people, we had the issue like this, so tell me what I need to do. I sometimes talk to clinical psychologists, but I sometimes talk to very random people and ask their opinions as well. Because sometimes good ideas come from very random people. So you talk to a lot of people, you understand the way people see things are very different. From the therapist perspective, yes, I feel like yes, you have to do homework, this is how you are going to get developed and all these kind of things. But I sometimes miss the perspective of the client. I empathize, but I don't understand his side of the story sometimes. So it's important for me to reflect on my experiences. So when clients directly reject saying, you don't know what you are doing, I think those are wake up calls to go home, think more, and think how to improve our services. So those are extremely important things. And I think those are some of the key differences between a clinical psychologist and a counseling psychologist. And we do have some challenges as well in this particular field. One is we need to always provide evidence for what we do. It's easier for me to say that these kind of things need to be done and all, but it's important that we show the real proof for the things that we do. So we have to ground our counseling work in empiricism. So empiricism means being able to show. So once again, empiricism is a philosophy as well. So whatever we say, our senses should be able to experience, and so those are very important things. Once again, so I want to today end this by giving some basic counseling skills. So I have just listed out some of them. In counseling, when you do psychotherapy, it's very important you have good nonverbal communication. Your posture matters a lot. Your facial expressions matter a lot. The way you smile, the way you talk, and all those things matter a lot. I think one of the fundamental mistakes a lot of students do is they try to take it like a structure. It's very structured. You are not doing a doctor's job. Doctors can sit down and ask, tell me, what your problem is. You have this and that and that. I think you have this. So that's what a doctor would do. You go and talk to a lawyer. Lawyer will have a similar strategy sometimes. But can you have the similar strategy when you go and meet an architect? No, right? Architect needs to sit down and understand new ideas. Then only he can come up with something, and he can't come up with that same thing on the same day. He probably might say, okay, look, give me a month, I'll try to do something, and they might call back and forth. That's their style. Likewise, for us also, we shouldn't be too much solution driven. I think it has come to that level because of the exposure that we have for medical doctors. We can't come up with solutions like that. Overnight solutions are very difficult in counseling and psychotherapy. So, nonverbal communication is extremely important because the person should feel that you are someone who is easy to talk to. Before even thinking about solutions, the person has to feel that okay, this guy is someone whom that I can go and speak about my problems. And you should be able to reflect on how you do things like we discussed. And active listening is extremely difficult, although we think it is easy. See, we have to direct our full attention to the things that the other person is saying, and our reactions are minimal. I am not, always jumping in the middle and say, look, මටත් මාර වැඩක් වුණානේ ඔය වගේ. So that you can do with the friend, but you can never do that with your client. Your story is not required there. Client story is required. So then active listening is very difficult because when clients say stuff, suddenly sometimes, some days I start to think about my own stuff as well, because when he says something, I start think of something. But when that happens, it's important that you know, okay, I'm thinking about something else. I need to, switch back to my client's story. And you have to paraphrase as well. Paraphrasing is important to let your client know that you understand their issue. When the client says, look, I have so much of trouble, difficulty sleeping yesterday because of all these issues. When I talk to him, I can tell, now that you told that sleeping issues are, you know, uh, there in the picture, what else have you experienced yesterday other than the sleeping issue? When I talk like that, they already know, he knows that my sleeping issue is a real thing. When I paraphrase and explain their things, what I do is, in some sense, I make them know that yes, I understand your issue, but at the same time their problems are slightly being validated also. When I say that, other than the sleep issue and all of these things, was there anything else you felt yesterday? So when I ask like that, I already have acknowledged he has a sleeping issue, she has a sleeping issue. It's some form of validation also. And once again, conversational abilities are extremely important. You have to ask questions, gather information, and it has to be discussion based. You have to do it like a discussion, like two individuals getting to know each other. Think about how you pace yourself. Think about, the tone that you use. Think about the kind of words you use. Think about the filler words you use. If you always use words like um and things like that, those things destroy the quality of speech that you have. So it's very important you have a good understanding about those things as well. And we discussed about empathy. Place yourself in your client's shoes. When they say that this is what happened, try to imagine their world. You have to place yourself in their shoes and think, what others may have told them. And you have quite a lot to do as well. I think you can genuinely react to certain things. So even silences are important. You don't need to always speak with your client. There can be brief moments of silence, which could be very therapeutic as well. And even, breathing, breathing out like a deep breath and all of that, to show that, that there is some kind of relief after like a good discussion. It's not a bad thing. And then sharpening your awareness, being more mindful about what your client is doing when he or she speaks. Those things are very important skills. Being able to summarize issues, being able to identify areas to challenge, and also mirroring your client. Mirroring your client is very important. See, I'll tell you a good trick. You go and talk to some of your friends, you will notice that some of them have very similar gestures. Like, for example, similar styles of talking. And you will notice some of these gestures are unique to you, and your gestures are used by others because they mirror the gestures. Whatever the gestures that you have, they mirror them. Why? Because they identify with you. And then when they mirror, you feel more connected to them as well, because you see yourself in them. And sometimes therapists can do these things as well, like synchronizing the breathing, synchronizing or mirroring some of the postures, mirroring some of the communication styles and stuff like that. So it's a combination of a lot of things. And this mirroring is a technique that was widely discussed in Milton Erickson's hypnotherapy work. So you can actually type on Google like mirroring and in psychotherapy, and you will be able to find so much of information about this. So those things are once again very essential skills. And in addition to that, Carl Rogers came up with three core skills that are important for counseling. In we call them Rogerian core conditions. So the first one is congruence. When the therapist is being real, authentic, and genuine with their clients. When the clients say something, I understand something, and what I understand and what I have give out, there needs to be good congruence. I can't say, yeah, yeah, I feel what you are saying, and then inside my mind, I can think, what a small issue. That there is no congruence in what I do and what I think. So there needs to be good controls. I need to genuinely believe, and I need to genuinely give my feedback, and at the same time unconditional positive regard. I have to be non-judgmental, and I have to be accepting. It's very easy to tell, but very difficult to do. I meet people who have done nasty things sometimes to their wives, to their family. So accepting them 100% certain days is very difficult. And some days I tell, if I feel like I can't do it, I always tell, I think I'm not the right person for therapy. Maybe you can go for another therapist. And very recently, I have been discussing with a person, medical student, and she has had multiple relationships. I think about 20 or 25 relationships, with very physical relationships. So um, she has some kind of like a sex addiction of some sort. I can't tell you that it's addiction. No one didn't diagnose her, but it felt like that because she has that many relationships. And then when she talked, I was clueless as to what I need to do. And she says that, she's very vulnerable. But then again, the issue is I can't, really think what exactly is happening here, because in my mind I can't accept it 100%. So that's a problem. Partly, it's my problem as well. But what I wanted to say is unconditional positive regard, it's very easier to tell, but it's very difficult to do when things are against how you believe. I want to bracket them and keep them aside, but still sometimes very difficult. And I have met individuals who have weird sex habits, uh, things that really put down their wives and all of that, and they come and speak, and it's natural for me to get slightly angry. I don't show it, but then I know I feel that, and then the wife wants me to help him. But then again, when I listen to what he has done to his own wife, sometimes I think, why should I do all of this? So then unconditional positive regard, yeah, I need to show it, but sometimes very difficult. So that also comes with so much of self awareness, and those are things that I had to work on myself, to do a good job in that kind of situations. And then finally empathy. Okay, so those are some of the things that I wanted to mainly mention, and these are some of the movies that you could watch from pop culture to understand more about psychotherapy. A Dangerous Method, a great movie that shows about Freud, Jung, and hysteria. And then Augustine is a French movie that demonstrates the life work of John Martin Charcot and hysteria. And there's another one called Professor Marston and the Wonder Woman. So you should definitely watch that, because it challenges so much of assumptions people have about just love and marriage and this kind of concepts. Okay, so any questions from what we have discussed today?